Hi, thank you for being here. Welcome to the Be Well Clinic YouTube channel. My name is Holly. I am one of the practitioners with Be Well Clinic. And today we're talking all about breastfeeding support. So what to do when. We're going to talk about a couple different questions that I am frequently asked regarding breastfeeding. So it is National Breastfeeding Month here in August. And so we've done lots of different talks about breastfeeding and articles and different things. But today we'll talk about 5 things that I get asked frequently. About me, I'm a wife and I'm a mother of 3, still breastfeeding my youngest. I'm a functional nutritional therapy practitioner and certified GAPS practitioner. I'm an RN and a online course creator. Now, I'm not a lactation consultant. However, I do assist mothers a lot with breastfeeding. And honestly, I think out of all of these credentials, being a mother of 3 is what has given me the most knowledge and experience with breastfeeding. So from my professional and personal experience, I'm going to just give you my insight into these common questions that I'm frequently asked. All right, what are these questions? So engorgement, what is it? What do we do? What's normal? Clogged ducts and mastitis, same questions. What is it? What do I do for it? Do I have to get on antibiotics or not? What are the best treatments? Nursing to sleep. This is a really big topic because there's so much opinion about this. So I'm going to give you my thoughts and you can choose from there how you want to handle it. Spitting up, again, baby spit up. So when do we know if it is important or, something that's that we need to intervene with or if it's normal? And then assistance. Who do I go to? When do I go to them? What are my resources? All right, how many breastfeeding women experience questions or concerns about breastfeeding? 100%. Okay, so to be honest, I did not poll anybody. I didn't do research to find this number, but I'm going to say it. I'm confident 100% of women who are breastfeeding have questions or concerns about breastfeeding at one point or another during their breastfeeding journey. So if you are a new mom, you're breastfeeding for the first time, having questions and concerns is entirely normal. If you've been doing this for years and you're on your 8th baby, having questions and concerns, again, is totally normal because your body is different with every postpartum. Your baby is different with every postpartum. It's entirely normal to have questions. So if you have any of these questions, please continue on with me. And if you haven't experienced these yet or don't necessarily have questions about them, I'd love for you to keep on looking on because there's a couple things that even if you haven't experienced mastitis or something like that, there's a couple things that I think are really important for every breastfeeding mom to have on hand just in case they do start experiencing that. All right, engorgement. So what is engorgement? This occurs when the body is trying to decide and interpret how much milk is appropriate to produce. So this usually happens in the first week, usually around days 3 to 5 postpartum. And it can last anywhere from a couple days to a couple weeks. And then you might also experience this later on, like if you're going back to work or if your baby is weaning or if your baby is sick and just not eating the same, changes in stress levels or you go on vacation or just different changes, your body can experience this. But it's most typical during that first week when your body's just initially trying to figure out how much milk am I supposed to supply for this baby right now. It feels like your breasts become enlarged and they can be hard, they can be really tender, it can be really uncomfortable. But again, this is something that's just your body learning how much do I need to produce. So it's a really important process to go through. So what can you do for it? Breastfeeding is the best treatment. So best treatment, just frequently breastfeed. This can look like breastfeeding your baby every hour in the beginning, which can seem tedious and like a lot and it is, but honestly this is the best way to go because this is showing your body how much your baby needs to eat, especially then in the beginning. Now when your breasts are really large and tender and there's a lot of pressure, it can really tempting to pump or hand express. And that can be appropriate, but at the same time, you don't want to pump or hand express a lot. You're not trying to empty out your breasts with that. You just would want to pump or express a little bit to relieve some pressure before you nurse so that your baby can then really set the stage with how much milk is needed for your body to produce. If you are exclusively breastfeeding, try to stick as close to the recommended amount of pumping as you can. So again, if your baby's not actually latching onto your breast, but you're exclusively breastfeeding, it's the same rule of thumb. You want to stick close to the amount that is the recommended amount that you're pumping, and then just do a little bit more just to relieve that pressure. So you don't need to be in this constant place of just feeling so much pressure and tenderness, but at the same time, we want your body to regulate it along with your baby as much as possible, rather than you tampering. Now, temperature therapy can help with symptoms. So cold compresses can help, and then warm showers can help. So you just need to see what your body prefers. Sometimes try doing cold, sometimes try doing warm. You'll be able to tell really what your body wants. And a lot of times you can even, before you try it out, you'll think, oh, that sounds like it's going to be helpful, or no, that doesn't even sound good. So go ahead with temperature therapy. And then some other recommendations. Cabbage leaves can be really helpful with this. Now, cabbage leaves do actually reduce your breast milk supply. So you don't want to be doing it continuously frequently, but having that on just to relieve a little bit and help to reduce the swelling can be really helpful. So what you do is you get a cabbage, wash it, keep it in the fridge so it's nice and cool. And then you're going to take off a cabbage leaf when you're ready to use it. You're going to make a hole in the middle of that cabbage and just stick it on the breast. And your nipple's going to go through that hole. So you're not actually putting the cabbage right on your nipple, but it's just on the breast tissue. And that can be really helpful. Keep it on for only up to about 20 minutes because, again, you want to soothe, but you don't want to really reduce your milk supply, especially there in the beginning. And then a supportive bra. So you don't want it to be too tight. You don't want to be putting too much pressure on there. No metal. Or wire, under wire, but at the same time, a supportive bra, so it's not just a lot of weight on your back and your shoulders, can be really helpful. So something that's just going to help to lift your breasts is great. Okay, clogged ducts and mastitis. So this is pretty common. This is a common question. At some point or another, you're probably going to experience a clogged duct. Not a problem. There's so many things that we can do for it. We want to work through clogged ducts before they get to mastitis if possible, because a clogged duct can turn into mastitis. So we'll talk first about clogged ducts and then we'll go into the mastitis. Now, antibiotics. This is a common question also because antibiotics are the standard practice usually with the allopathic medical model from my experience and from what I've seen. Even from talking to some friends who are in the postpartum medical world professionally, they have expressed, well, antibiotics are the only way to go, right? Like if you get mastitis, you need to have antibiotics. And I disagree. There's different things that we can do before you get to antibiotics that can absolutely help to relieve and heal mastitis. All right, so let's first talk about the clogged ducts. So when you have a clogged duct, your symptoms are, it'll feel firm and tender, but it's more localized. It's more in a smaller area, not really the entire breast. It can be red or inflamed and warm to the touch, but again, not systemic and not necessarily throughout the whole breast, but more of just the one area. What you can do for it. Now, antibiotics are not standard practice with clogged ducts because this isn't an infection. This is just that a duct where your milk is coming through has gotten clogged up. So the main thing you need to do is just keep getting flow. You want to just flow and help remove the plug or the clog from the duct. So the best way to do that is breastfeeding. So keep on breastfeeding. It might be tender, but you want to keep on breastfeeding just to keep the flow of the milk going through. You can pump and hand express in between feedings also. So different from engorgement, this is when you really just want to keep a flow. This might change how much your body decides it needs to make for your baby, and that is okay right now. The more important thing is to help remove that clog. A warm, wet washcloth is really helpful with circulation. So any warmth is going to help with the circulation. So I'd recommend doing that. Then getting in the shower and actually having that shower water kind of pummeling down on your breasts can be really great. When you're in the shower, you want it to be hot water, obviously not hot enough to burn your skin, but on the hotter side. And then you want to be massaging through it. So you're going to be massaging with your hands, starting up at the top of the chest wall and just working the way down toward the nipple. One of the best ways to do this that I found is using an oil on your skin. So something that's edible like coconut oil or tallow or olive oil, something that you could eat and would be safe to go on your breast, and just rubbing that onto your breast and then massaging through that. You want to massage from above the place of the clog and then down toward the nipple. Likewise, just like massaging, a large tooth comb can be really helpful to be kind of brushing that out in the shower with that oil. An electric toothbrush or something else that has a vibrating motion, if you put that right on top, it can help to break up the clog. And then you want to hydrate a ton. Really important. As you're breastfeeding, you're losing a lot of fluids. It can be, it's not always on the front of our minds to be hydrating well, but remember that's really important. So just be guzzling the water, make sure there's minerals in your water. And then lastly, you want to rest. So as my sister says, you want to get horizontal. That was always her advice to me if I was going through this. Get horizontal. So meaning get your feet off the ground, lay in bed, let your body rest. Because as your body's healing, as your body's working through anything, it uses so much energy toward that. And so you want to reduce the amount of energy that it's using for other things. So get off your feet, get into bed, and just rest as much as you can. All right, let's move on to mastitis. So similar symptoms. They will be firm, or they can be, right? Everyone has different symptoms with illness, any kind of illness. But these are the common symptoms that you might experience. So firm breast, not so much just one area now, but a larger area of the breast, more painful, red and inflamed again. Now it's hot to touch. You could get a fever and chills. You get body aches, more systemic things. Now, usually, like I said before, if you do go in to an allopathic Western medicine facility, they probably will recommend antibiotics for you. Just again, from my experience, what I've seen. But I have a couple things that I always recommend doing first before that. So if you feel like you need to go in somewhere, absolutely do that. But if you feel like you are at a place where you are able to try some things at home, then that would be where these come in. So keep on breastfeeding regardless. You want to keep on breastfeeding. Again, really important to just be drawing out the infection from your breast. Get the circulation going. Again, pumping and hand expressing between feedings, same thing. A lot of people get concerned with feeding their baby when they have mastitis, whether it's healthy or not to be able to do that. Well, from my experience and from what I have learned, the baby already has been exposed, right? That infection didn't just start right that day, right? The baby's been exposed to it. And so actually continuing with breastfeeding and giving the baby the antibodies and the nutrition through the breast milk is usually the best thing to do, even when you have mastitis. A warm shower, just like before, same idea, but this time you don't want to be really rough on it. So a clogged duct, you're kind of just trying to work it out. With this, you want to be more gentle. Again, the oil or edible or fat, so coconut oil or olive oil or tallow or butter or something like that. And you want to be just gently massaging. Oral tinctures and herbs, we're going to talk about that on the next slide, same as compresses and soaks. So there's a lot of really powerful things that you can do beside medication that can help reduce your symptoms and actually help to heal. And then hydrating, same as before. Do not stop hydrating. Even more important now, especially if you have a fever, body aches, you want to be making sure that your body has the hydration it needs. And then rest. Get off your feet. Even more important than with a clogged duct, get off your feet, get in bed, let everything else go to the wayside. You can keep your baby in bed with you so that you don't have to be getting up and going up and down and get your baby. Just keep your baby in bed with you and make sure you're resting as much as you can. Okay, so here is the mastitis protocol that is in the Nourishing Traditions book of baby and child care by Sally Fallon Morell and Tom Cowan. I have used this one personally and then also have recommended it for patients, and I have seen really good results with this. I've seen a lot of avoidance of antibiotics after using this. So tincture of propolis, again, this is the protocol that's outlined in that book. So you can get that book on page 130 is this, and there's a little bit more information in there, but there's tincture of propolis, 10 to 15 drops twice daily, tincture of echinacea, 2 dropperfuls as often as 12 times daily. I have been told that if you go above 12, that can cause some GI upset. So I wouldn't recommend going above that. Tincture of poke root, no more than 2 drops daily. This one is actually extremely potent, and if you go over the 2 drops, it can be really toxic. So very strong, especially if you are having a persistent mastitis and need something like something that's pretty heavy hitting. This is valuable, but make sure you do your research and you want to go low. With this one, more is not better. Then soaking in hot water. So same, again, don't burn your skin. Make sure it's cool enough for your breast, but as warm as you can tolerate. And again, just with circulation, this is going to help. Now, in the water, my favorite thing to do is doing a marshmallow root tea. So this is something where you can get make a tea. You're going to put it in a bowl and just kind of lean over one or both breasts, whatever you need. And this is very powerful. Marshmallow root is really good at drawing infection out. And so this one I've had really good results with. It does soothe, but more than that, it actually helps to really remove infection. So with this, you will steep a tea overnight. What's in the protocol in the Nourishing Traditions book is 2 ounces of marshmallow root, dried marshmallow root, in a 1/2 gallon of filtered water that's been boiled, and then let it soak overnight. Now that said, this part's not in the book, but what I've seen, if you need it before, if you can't wait overnight and you're trying to just kind of work it out as soon as you can, go ahead and get that started so you have that the following day. But also, even if you soak marshmallow root in hot water for 30 minutes, that's going to be better than nothing. So you can start with that. All right. And then while you're doing that, make sure that you're massaging and hand expressing while you're soaking. So you want to be expressing so that you're letting things draw out. You're helping the process with just the flow and the draw out. Then compresses with parsley or comfrey leaves. So parsley can be either dried or fresh. What you want to do is, what I've seen to be best is actually putting it in a diaper. So you can put it in a cloth diaper or a disposable diaper. The disposable, just make sure that it's not, it doesn't have chemicals and colors and all that stuff. But then you'll take your leaves, you'll put it in the diaper and kind of wrap the diaper up and tie it off with a rubber band or a tie and soak that in water. Once that's been soaked in water and everything is nice and wet, then go ahead and just sit on the breast, and that compress can just feel really good, especially soothing. So this is more for pain. It can be more healing, but it's also very soothing, and on one or both. Then a topical oil that's infused with calendula or elder or dandelion. I love these. I've done another video. If you look at our garden tour video, I talk about how I do the calendula infused oil. Really easy to do. Calendula grows beautifully, at least here in Colorado. And I really recommend that. Now, if you can't make it yourself, obviously it's a long process. So you can find these oils infused. Or if you need to, even just an oil, like an olive oil or something like that, can be really nice to put topically. But I do recommend doing it with the herbs. And then a cold grated potato applied topically. It's probably the messiest one. Although the marshmallow root is kind of messy. It does get really slimy. But that's normal for that. So the cold grated potato, you wash your potato off, just grate it up nice and cold. Go ahead and put that on, have a towel or something underneath you. And that can really help also symptomatically. So helping with the pain, especially. Okay, now for topical therapies, remember that shorter and more frequent is usually more beneficial than long exposure only once or twice during the day. Okay, so rather than doing one soak for 45 minutes or an hour, maybe do 4 or 5 soaks for about 10 or 15 minutes each. It's going to be more effective typically. All right, nursing to sleep. So what is normal? Why does the baby fall asleep at the breast so often, especially if that is something that we are commonly told not to allow? And then we'll talk about breastfeeding if it's just for feeding, or what else it is there for. So is nursing to sleep normal and healthy? A resounding yes. Yes, it is. For some reason, there's a lot of talk about structuring your baby's schedule to be eat, play, sleep, right? Have you heard that one? I'm sure that there has been some research done on that. I'm sure that there's a lot of good intention, but I'm going to be honest with my experience, especially personally. I have not seen that work. And letting your baby fall to sleep at the breast is normal and healthy, because your body actually, in your milk, there's hormones, there's amino acids, there's qualities of the milk that cause your baby to get sleepy. In addition to that, the sucking motion also helps to induce sleepiness in mom and baby. So this is supposed to be, the way that this was designed was to be a relaxing, a comforting time together. And of course, you're going to fall asleep, especially if you're a little infant, right? So it is normal, it's healthy, it's appropriate. There's the breast milk was designed for that, to help to induce sleep and comfort. The Kelly Mom website, if you haven't been there, they have a lot of research about this. She has a lot of different research articles that she links to. So I would recommend looking into that if you are curious about this more, about the qualities of, or the properties of breast milk that cause more sleepiness, the safety of it, that kind of thing. And then finally, the function of breastfeeding is you are not just a source of food. You are absolutely a source of food, right? But you're also a source of comfort and of nurturing, of soothing. You are a place of safety. You are creating this place of trust with your baby. And so, of course, in this beautiful, nurturing environment, it is normal for your baby to come so calm and feel so comforted that they can fall asleep. So I see nothing wrong with it. I think it's actually a really beautiful thing that was created for us as mothers to be able to have this bonding relationship, and sleep is such a big part of that. All right, let's move on to spitting up. So should I be concerned? Now, maybe and maybe not. So every time I assess a baby, whether it's spitting up or something else, I'm looking at them holistically. So if they are spitting up, are they happy and calm? Are they sleeping well? Are they gaining weight? Is their skin clear? Are they, generally overall acting well? If so, then most likely it's not something you need to be very concerned about. However, if they're not sleeping well, if they are sick or have intolerances, if they have projectile vomiting, if they are losing weight and not gaining weight appropriately, if there's any of these systemic things that are concerning, then absolutely it is important to look into this. So some possible causes of spitting up that might require some intervention are listed here. So it could be just a powerful letdown. If it's that, this is usually something that's fairly easy to deal with. You just hand express or pump a little bit before your baby breastfeeds so that they are not just overwhelmed by this huge flow of milk, right? So do that, let it subside, kind of let the letdown just express that out, and then let your baby nurse. And if that takes care of it, fantastic. It also could mean that there's a need for gut support. Babies need a lot of gut support, right? They are exposed to so much, whether it is in the air, the water, the environment, whether it's in their milk or their formula, whatever it is, they might need probiotics. They might need some change in nutrients. They might need some change in environment. And all of that goes into gut support. Sensitivity to breast milk and formula. So I actually personally have seen, in my practice have seen a lot of people coming in worried about sensitivity to the breast milk. And I would actually say that is not as common as most people think. So a lot of times people say, oh, I must have to take something out of my diet. That's not actually that common. For people to need to remove foods unless they are just not real foods, right? Sugars and processed foods and grains that have not been soaked. Like if it's not a quality food, if it's a pasteurized dairy, something like that, that can be something that should be removed because it's not actually a good quality food. But if you are on good quality food, you're properly preparing your foods, there's a much less chance that your baby will have sensitivity to breast milk. Formula, on the other hand, a lot of babies do have sensitivity to formula. And I know we're talking about breastfeeding right now, but if your baby's spitting up and on formula, you might need to try switching it up, whether it's a homemade formula, like Weston A. Price talks about on their website, or even in the book that I referenced before, the Nourishing Traditions book for babies and kids. There can be a few different things that might need to be changed with the formula. Then there could be a need for chiropractic care. So chiropractic care is very important, can be really helpful with babies, especially with gut issues. So like spitting up, they might just need an alignment. They might just need an adjustment that makes sure that the brain and the gut and the nervous system is all working well together. Then it could be a tongue or a lip or a cheek tie. This can absolutely cause the baby to spit up and not to be able to digest well, so not suck well, get extra air in, not digest appropriately. So there could be a lot of reasons why those would cause it. It could be a nutrient deficiency. We kind of touched on this before, but still you could be, everything could be good, but you might just be lacking one nutrient. And then it could be reflexes. Maybe the baby has not progressed or integrated the reflexes appropriately. That's something that we talk about with our first year of care package that we do for babies in our practice. They always get their reflexes assessed. And it's really important to make sure that reflexes are progressing as they should, because postpartum, after birth, a lot of times things can get a little bit skewed. So that can be a really big one as well. Now, just remember with all of these, this can sound really involved. You do not have to be the one figuring out what of these could be causing the spit up. So make sure you seek help, because that's what we can do. Any of our practitioners at Be Well Clinic, we can help decipher what might it be that is going on. Who do you need to talk to, whether it's us or another practitioner we can refer you to. So that's what we're here for. We are here to help you not have to figure out all the causes and interventions yourself, but to help you do that. Okay. So reach out if you're concerned about any of these. Okay. And then when do you seek assistance? As early as possible. So I really believe that every mother, whether this is their first baby or their fifth baby, should have breastfeeding assistance. Breastfeeding help, breastfeeding support. And this can even be as early as during pregnancy. So while you're pregnant, talk with your midwife or your OB. You can even get in touch with a lactation consultant. You can talk with them about your concerns, but your provider should be able to help you figure out, at least go through the basics of breastfeeding before your baby's even born. Now, I think it's really important to have at least 3 specific people in your life helping you with your breastfeeding journey. So the first is the mama who's on your level. So somebody who's going through this at the same time. Maybe they have given birth within a month or so of you. If you don't have this person, a friend or a sister or somebody who's doing this, then contacting your local hospital or your birth center or your midwife, they should be able to connect you with somebody who's going through this at the same time, so that you guys can just share, hey, is this happening with you? Is this going, just having that camaraderie and someone going through it with you is really important. Then next, the mama who's ahead of you. So somebody who's 10 years ahead of you, or even just 6 months ahead of you, somebody who's been where you are, and who can help give you advice for, tangible, practical, even anecdotal advice that's really, really valuable. And then the professional. Now, I really believe that it's important to have somebody who's professional there helping you, whether that's a chiropractor, a primary care provider who is well-versed in this, a nutritionist like myself, a lactation consultant, of course, somebody who can help you out, that you can trust, and they can take the guesswork out of the equation. So this can be in a group setting. A lot of times midwives run group sessions, like breastfeeding sessions. It can be one-on-one if that's necessary. And there can be a lot of different people doing this. But the main reason why I think this is so important is because postpartum is a really confusing time. It's an exhausting time. Even if you're a year postpartum, it doesn't matter how postpartum are you. Your hormones are changing. Your sleep is different. There's so many changes going on. And confusion and overwhelm is extremely normal. So if you can find someone that you trust, that you can just ask a question, they give you an answer, and you say, okay, I'm going to go with it, kind of your guru, I think it's really important to do. And then finally, if you are someone like me who just really likes to have a lot of people around, find your tribe. So whether it's a group of people who get together, it's mamas who do yoga together postpartum, or a actual breastfeeding support group, MOPS at your local church, or just a group of moms that you can get in with, I think it could be really helpful. If you're not like me and you prefer to be more private about your breastfeeding life, totally fine. Find at least these people, someone on your level, someone ahead of you, and then a professional who can help you out. All right, and then finally, talk to us. So we are here to support you. Our practitioners, myself included, would love to help direct you to who would be helpful for you. So if that's an oromyologist, if that is a chiropractor, if that's ourselves, whoever it is that we can refer you to, and however we can help you out, we want to. So get in touch with us. Currently, we have 2 locations, one in Northland and one in Loveland, Colorado. You can call either location. You can go to our website, make an appointment, or just give us a call, or our email address is down there. So thank you for going through this with me for the last 30 minutes. It's been a pleasure. And of course, there's so many more questions out there, right? These are just some top hitters that I hear a lot. But if you have any other questions, get in touch. We would love to talk with you and just help you be as successful as possible on your breastfeeding journey. All right. Have a wonderful day. Thank you so much for joining me here.